I'm Savannah P, and this is my NG tube insertion video. So the first thing we're going to do is we're going to check the chart, make sure there's an order for the NG tube. We're going to make sure that we have the correct patient by asking them their name and date of birth, checking it with their bracelet, and checking it on their chart. I'm going to perform hand hygiene. And I'm going to explain the procedure to the patient. So today we're going to put a tube, it's going to go up your nose, and it's going to go down your esophagus into your stomach. That way we can give you feedings and we can administer medication that you can't swallow on your own. All right, so I'm going to make sure I have my supplies. I have lubricant, the tube, a draping and tape, and clean gloves because it is a clean procedure. I'm going to go ahead and drape the patient just to keep them clean in case anything spills or dribbles. And I have my tube. Right now it is unwrapped, but it would be wrapped up and completely clean. We're going to measure it from their preferred nostril to their ear tip and then down to their xiphoid process. We're going to make sure that their nostrils are clear, and we're going to ask them if they have a preference on which nostril. So we check the nares, they're all clear. And we would mark on the tube where we measured it, but this tube is already marked, so we're going to go ahead. So the patient is going to tilt their head back to start with so we can visualize the nostril. You can lubricate the tip. I didn't do that because I'm doing it on the mannequin. Once you reach the pharynx, you're going to stop. If they get uncomfortable, if they gag, we're going to pull back just a bit. We're going to let them catch their breath. We can offer water, ice chips, and as they swallow, we can advance the tube down to make it more comfortable. We're going to have them tilt their head forward for this next part. And as they swallow, I'm going to continue advancing the tube. All right. Once the tube is in place, we're going to hold it. We can tape it. The tape is split, so we can wrap it around both sides to keep it secure. And just for extra security, I'm going to tape it once more across the nose. If at any time during the procedure the patient starts to gasp, cough, have trouble speaking, appear cyanotic, I'm going to discontinue it immediately because that shows signs that it went down the wrong tube. Okay, for medication administration, we're going to make sure we have all our supplies. So we're going to have a 60 milliliter syringe, water for flushing, our liquid medication or a pill that's crushed up and mixed into water. And we're going to make sure that we wash our hands and apply gloves. We're going to verify our order in the patient's chart, verify patient. Now before we can put anything down in NG tube, we have to make sure that it is in the correct place. So we'll do that by performing an x-ray to visualize the placement, or another option is to aspirate the fluids and check the pH to make sure they are gastric fluids. All right, so first things first, I'm going to draw up my water. So we have 25 milliliters here. Clamp the tubing and connect the syringe, and we're going to flush the tubing. If the patient is having any kind of tube feedings or suction done, we want to make sure that is discontinued, obviously. Before we do this, we'll clamp again, remove the syringe, and remove the plunger. Reattach the syringe without the plunger. And we're going to put our medication in the syringe and unclamp and letting that flush down. All right, when it's done, we're going to reclamp. Try to keep any air out of there. And we're going to flush again with water. And when that's done, clamp once more. We're going to make sure we check for any residual. We're going to reapply tubing, and we will document. Nasogastric tube. We would verify the discontinuation order first. So we're going to first start by untaping it. We're going to make sure that it's clamped. If there's any feedings going on or any kind of administration through the tube, we're going to make sure that is completely stopped. We're going to ask the patient to hold their breath as we remove it, and we're going to remove it quickly and steadily.